Good evening. The death toll climbs every day by a little more, and so does the urgency around the question, how bad can it get? We've seen a leaked document warning that NHS staff that up to 80% of the population could be infected in the next 12 months, meaning up to 7.9 million people might need hospitalization. And even if we ramp up our hospital bed, nursing and ventilator capacity dramatically, how can the system cope? 35 people have now died in the UK, with a total of 1,372 positive tests, up from 1,140 at this point yesterday. The Health Secretary has said that over 70-year-olds will soon be asked to self-isolate for several months. 100 million Europeans are now under lockdown as countries tighten their restrictions. The entire world is going through a stress test that just a few weeks ago belonged to the lurid fringes of dystopian fiction. Here in Britain, emergency legislation will be detailed on Tuesday. This could be the beginning of a lockdown. This morning, the Health Secretary confirmed that everyone over 70 would soon be asked to self-isolate at home for up to 4 months. That, too, is astonishing. Here's Simeon Brown.
As the death toll rises from 21 to 35 in a day, this week the government is stepping up action, promising to increase awareness with videos like this and to beef up its powers.
This response is going to be one of the biggest challenges that our generation faces, because the sorts of measures that are needed are simply not the sorts of things that you normally have to contemplate.
The government will publish a bill setting out emergency powers to combat coronavirus in the UK. Elderly people and the vulnerable will soon be asked to stay home for up to 4 months. People who pose a risk to public health could be forcibly detained. Factories will be asked to make life-saving equipment for coronavirus patients. And the government may commandeer private wards and hotels for NHS care, as well as turning operating theatres into ICU wards. These new laws follow leaked plans to ban mass gatherings like this one. After London Marathon was postponed, this run in Liverpool chose to go ahead.
We've worked with everyone around us, the police, the ambulance, we've got private medical teams that look after us, and our information is that at this point in time it was safe to go ahead. And if it's safe to go ahead, it's important that this country doesn't shut itself down prematurely.
I'm doing my bit. I mean, I work in the NHS, and I'm following every guideline. I wanted to be here today. I wouldn't have come if you told me not to come, but I've been watching the news, I've been watching everything, I've been doing what I've been told. I'm wearing gloves that I'll throw away at the end, I won't keep, so I can't do more than that.
But what is normal will have to change if the country is to stay ahead of the pandemic. Next week's government's plans will have major implications, especially for the elderly, who face increased isolation.
Clearly, since our top priority is to protect life, and that means protecting the vulnerable and protecting the NHS so that it can be there for us, this is one of the measures that's in the plan.
Attention is also turning to NHS capacity. The government has admitted they cannot guarantee that everyone who will need a ventilator can get one, and is now urging manufacturers to help produce critical machinery for the NHS as part of a national effort, unseen since war times. The government is also under renewed pressure to finally expand testing, as the Scottish Government announced that they will be increasing surveillance.
What we are doing is increasing our community surveillance testing that will cover about 1.2 million, and that gives us an idea of the size of the virus in the Scottish population.
But politicians are not the only ones planning for the worst, as stockpiling of food continues.
Jesus, there's a lot of people.
Ahead of next week's new powers, this is the picture the government was trying to avoid.
Well, this programme has seen a document indicating that not all healthcare and other essential workers with symptoms will be tested because there simply isn't the capacity to do so. The testing prioritised in order of clinical need. Public Health England say they won't comment on the contents of a leaked document, and it is still subject to ongoing discussions. Well, joining me now is Victoria MacDonald, our health and social care correspondent. Victoria, these numbers are truly alarming, and they will alarm many of those watching the programme. Put them into context, please.
Well, they were working on an assumption that 80% of us might get coronavirus. Now, that is an awful lot of people. They also say that 7.9 million people may end up in hospital, and the hospitals just will not be able to cope. as well as all the people who are at home who've got a cough. Actually, interesting figure is that 10% of the population will have a cough at the time of the peak COVID-19 anyway. They say, Public Health England, in this document circulated to senior NHS staff, they say they have 4,000 lab testing a day available currently. They want to expand that to 10,000. But if you think there are 2.5 million health and social care workers in this country, you can see the problem. So they've put it in order. They're going to test people who are in critical care with pneumonia, those who are coming into hospital with pneumonia, and then clusters or outbreaks. So maybe if there is an outbreak in a nursing home, the only exception they might make is if they need, say, a super specialist surgeon who needs to do some life-saving surgery and is currently at home with a cough, they might expedite that. But this will worry a lot of healthcare workers who will be in the front line and be worrying about their own safety and their family's safety.
Victoria, thank you very much indeed. Like yesterday, we asked for an interview from the Health Secretary or a minister from the department to come onto this programme. None was available. So across the world, country after country is self-isolating as governments close borders, stop flights and enforce lockdowns of day-to-day life. Yesterday, Spain, Denmark and Norway pulled up the drawbridge. Today, Germany. Here, the Foreign Office has updated its travel advice, warning people against visiting certain countries. This morning, it added the United States to the list, 24 hours after Donald Trump said that all flights from Britain would stop. So far, the FCO is still not advising against travel to France, while Italy has recorded another 368 deaths in just one day, worse than the deadliest day in Wuhan. Here's Minnie Stevenson.
Milan's motorways deserted. Paris eerily quiet. Venice empty. Around the world, countries closed, as more than 100 million Europeans are now living in lockdown. In the last hour, Italy announced they have had 368 more deaths in a day, as the nation desperately tries to build new intensive care units. To Spain, where they woke up to their first day of their new normal, people only allowed to leave the house to buy food and medicine. Once mundane weekly shops, now stockpiling, as the country enters a 15-day state of emergency. And welcome to the future. Police fly drones in Madrid telling people to stay at home, as deaths from the coronavirus more than doubled in a day. 288 people have now died in Spain. In France, cafes, restaurants, cinemas and gyms closed as the polls opened for local elections, voting in a more vulnerable-looking Paris, as President Macron said lockdown would continue for weeks.
Only a few hours ago, many of our fellow citizens were still at terraces or cafes, living as if nothing had happened. We told them simply that this is no longer possible. It's stupid. You're making a mistake because you're exposing each other.
As Germany is set to close its borders to France, Switzerland and Austria, where the Austrian government have now banned gatherings of more than 5 people. While nobody is going anywhere fast in Chicago, arriving to hours of queues for medical screenings at airports. In Dallas, no sign of social distancing here. Passengers waited to have their temperatures taken as President Trump's coronavirus test results arrived back negative. And then there are those who want to get home but can't. In Morocco, they've cancelled flights to and from 25 countries. As the British ambassador to Morocco had these words: "We will get you home, but it will take some time. If you see an available flight, I cannot advise you strongly enough to get on it. And if you're in the UK and thinking of travelling to Morocco, please don't." While on board a cruise ship where at least 5 people have coronavirus, stranded 600 passengers, most of them British, as the crew frantically searches for somewhere to dock. So far refused entry at several Caribbean ports. In LA, they're queuing to panic buy guns. But at this festival in Mexico, what coronavirus pandemic? Temperatures were taken on arrival. In Russia, some hoped for healing, kissing religious relics. And in Dublin, they continue to dance through the corona crisis in the Temple bar clubs. Today, the hangover. Those, it turns out, were last orders. The government announcing all pubs in Ireland will now close. After the party, the deep clean begins.
Minnie Stevenson. Well, joining me now from Yorkshire is the former Director of Maternal and Child Health at the World Health Organization and now Professor of Global Health at UCL, Professor Anthony Costello. Thanks for coming on the programme, Professor Costello. When you look at the numbers in the UK now, when you look at the numbers in Italy, and when you remember what the numbers were like in China, are we going to be Italy in 2 weeks from now?
Yes. Look, you can't fight a virus if you don't know where it is. The basic principles from the WHO is that you find, test, isolate and treat every case to break the chains of transmission. And the UK policy is worrying because they announced at the press conference that they're going to stop population testing. That's crazy. That's not going to delay the epidemic, it's going to accelerate it. And we will certainly be in the same situation as Italy, whether it's 10 days or 2 weeks or a bit further, we can argue about. Now, I don't have any problem with worrying or arguing about social distancing and mass gatherings and the like, and the timing of that. But we must be getting the data on what's happening. And everything in the WHO report from China is doable here. Why can't we do it?
So
Why can't we set up?
What should the government be doing now then?
They should be mobilizing the country. They should be setting up mobile testing centers. They should get the test result down like China from 12 days to 3 days. You've got to identify family clusters, get them isolated, look after people that can't look after themselves in isolation centers, get CT scans out into the communities or into populations where they can get to them quickly if they've got pneumonia. And you've got to, and obviously do the treatment that the NHS can provide, but we've got to prevent. And we can get this down. It's worked in China. It's worked in Korea. It's worked in Singapore. Giving up now and saying, well, we're just going to let this rip is going to cause a catastrophe.
Why is it not working in Italy then, for instance?
Well, because firstly, I'm not quite sure why it all focused around Lombardy, whether they got a number of super spreaders in or whatever. But I don't know enough about what they're actually testing. They're trying to cope like China did with the explosion of cases in Wuhan. And when they realized they'd messed up, they put in place all of this structure I've described, and it took them 7 weeks. But after 7 weeks, they had it under control. And more, if it is going to flare up again when they loosen things, they've got a nationwide system in place, got the data, they've got the mechanisms, and they can loosen it gently and then damp it down again. Ultimately, we need a vaccine. And vaccine creates herd immunity, not a disease that's going to kill 400,000 people. So we've got to mobilize our country. And I thought that's what they were preparing over the last month.
Okay.
And they're not doing it.
Sorry, running out of time. Let me ask you one very quick question. Can we turn this round at this stage, yes or no?
Yes, I think we can. It's going to take time. It'll take 2 months at least. But why not?
Okay.
Why can Asian countries do it and we can't?
Okay. Thank you very much, Anthony Costello. Well, amid some scenes of panic buying and empty shelves, supermarkets have asked shoppers to be considerate and refrain from stockpiling so others aren't left without things that they need. Retailers say that they are working with the government and suppliers to avoid shortages. But are they prepared? Joining me now is Tim Lang, who's Professor of Food Policy at City University in London. Professor Lang, thanks for coming on the programme. The government has said that the supply chains are guaranteed, the supermarkets will not run out of food. Do you believe those guarantees?
No, but I understand why they're saying it, and because they're saying it on normal conditions. The public doesn't really realise over the last 40 years or so, there's been a revolution in the food system. We don't have storage, there aren't warehouses, or not like there used to be with months of food. It's all just in time. The food system has borrowed from Toyota cars a system of literally having the food arrive at the supermarket back office just in time. That's very easy to disrupt. That's not me saying it. That's all logistics people know that. The supermarkets know that. So they need us to carry on behaving as normal. Now, listen to what Tony Costello from UCL was saying just before me. We're actually having to do catch up on planning. Britain actually used to be very good at food planning, but it was rolled back and run down. We need to think about that later.
Right.
But right now, we need to actually recognize there's a mismatch going to happen between supply and demand.
Okay, well, given everything you've said, should we now then have organized stockpiling?
No, because the system can't deliver it. Look, Britain, I've just written a book. It's not out yet, but it's out very soon, called Feeding Britain, where I've just gone through. I mean, it was written before coronavirus, but looking ahead and looking at the present insecurity of Britain, Britain only produces about half of its own food, you know. Actually, last year it was 53%, previous year 51, 50, 49. It runs out. We are heavily dependent on food that comes across the channel or through the tunnel. And the government has been playing posturing with that. The reason, with no deal Brexit, the reason I raise that, Brexit's happening, is because the government's own internal figures and own internal advice said, prepare. This is very dangerous. It can clog up.
Tim,
So
just briefly, one final question. One final question to you. What should the government be doing now, especially since borders all over Europe are closing? In 20 seconds.
That's right. They've got to actually set up a food planning committee. They are now beginning to talk more widely with the food industry. I worry that they're dumping responsibility onto the retailers. I sometimes call the default British food policy, leave it to Tesco et al. This is not a good policy. Government must get a grip. And actually, it's beginning to do that a little bit. I hear the arguments going on from my public health colleagues, but that's not happening in food.
Okay.
They're relying on the food industry to deliver when actually the food industry probably can't.
Okay, Tim, I've got to leave it there. Thank you very much indeed. Well, churches, mosques and other religious organizations say that they're making plans to protect worshippers from putting services online or on audiobooks to strict limits on numbers. And there are many concerns about how elderly people will manage over a long period of isolation at home. Will the answer lie in local communities rallying around? Here's Jordan Jarrett Bryan.
In an unsettling period for most, many turn to faith.
We are concerned, and there is fear in the air.
At this service in West London, numbers were low, even if belief is strong. Precautions are being taken with deliberate spacing between those who did attend, but here faith matters and is needed now more than ever.
Well, this is the point at which communities really step up. So faith communities, churches in particular, but all families, all other things that bind communities together. So church I was in last Sunday, for example, the priest at the front announced the idea that people might buddy up with one another and just make sure that they had actually got their phone numbers, that they were calling each other, perhaps popping an email, WhatsApp groups, all those sorts of things that people are now able to use.
And for much of the congregation, their reliance on their communities may well be tested. With many over the age of 70, the government's warning of self-isolation is one that's not ideal, but understood.
Well, I'm over 70, a bit tricky, but if I've got to do it, I've got to do it.
Would say you'll do that?
Of course I will.
Yeah?
Yep.
How would that impact your life? How would that impact you, you know,
horrendously,
Really?
but it might have to be done.
I think in this case it behooves us all to pay attention for our own sake, but also for the sake of others, because people may say, oh, well, I don't mind if I get it, I'm not going to last much longer anyway. But it's the knock-on effect on other people.
Well, it sounds like an absolute nightmare, because I think what we all need to do at this sort of time is to draw together with those we love, our families, and love is a stronger medicine than not talking to people.
I think we all just need to grow up and take responsibility for ourselves.
But it's not only the elderly who may be missing out en masse. With more and more stringent measures being imposed, it could be only a matter of time before religious gatherings are cancelled altogether.
We'll see whether or not smaller gatherings and churches do have to stop meeting, and if they do, then we are attempting to put in place things, and we already have things like the live streaming and the other ways of reaching to people, offering prayers through the internet, that kind of thing, to be able to reach people who may need resources to be able to keep praying and keep carrying on.
The coronavirus seems set to empty places of worship, but even if isolated, those who believe will remain united in their faith.
Well, in just a few weeks, we've entered a new reality. There are millions of Britons aged over 70 who could soon be asked to live in self-isolation, perhaps for as long as 4 months. Joining me now is Caroline Abrahams, who is the charity director at Age UK. Caroline, this is an astonishing fact that has just been confirmed by the government this morning. How will those millions of people, and how many millions are there, by the way, cope with this?
Well, we're yet to really know. And of course, some people are better placed to cope with it than others. So if you're lucky enough to have a very good and strong family around you, people living nearby, then I'm sure, you can, although this is scary and unwelcome, whoever you are, you can see a way through it. But of course, the people we worry about are those who don't have family around them, who perhaps don't know their neighbours, who are particularly vulnerable. And I think that means we're going to have to put in place very quickly a strong local infrastructure to support them.
How many people are there in this country aged 70 or older?
Well, I don't want to get the stat wrong. There's certainly 5.5 million over 75. So, I mean, there are a lot of people, basically. We're probably talking, I'm going to get the stat for my next interview. It's probably something like 6 or 7 million at least, though. So that's a lot of people.
OK, so what should the government be doing? What should communities be doing? Because we always talk about, a crisis of loneliness amongst the elderly. And this is going to make that so much worse, isn't it?
Potentially, of course it could. Although, alternatively, if we do all rally round, it might be the beginnings of an answer to loneliness that we've been looking for some time as far as older people are concerned. I think the first thing that has to happen is that the government does have to clarify quite quickly in the next few days exactly what this means. So does this mean that you're not allowed to have anyone come into your house over that period or your home? I've read 1 or 2 suggestions today that it doesn't. And does that mean you're not allowed to go out at all? So I have a friend, for example, who lives in a deeply rural village in Oxfordshire, who's 5 minutes away from her allotment, and she doesn't see anyone on the way or on the way back. Is she allowed to go to her allotment or not? So there's huge numbers of really practical, nitty-gritty questions that I think the government needs to communicate to people about very soon. And then once we know exactly what the arrangement needs to be, then we can start making sensible arrangements. But it's absolutely bound to need all of us as individuals to step up and to be good friends to the older people around us, offering to collect shopping and collect medicines, those sorts of things.
OK. And in 10 seconds, what can you tell elderly people watching this programme tonight in terms of reassurance?
Don't panic. We'll get through all this all together. It's not going to happen absolutely straight away. And we will prepare, and we're all going to be there to support you.
Leave it there. Caroline Abrahams, thank you very much indeed. Now, National Health Service GPs are very much on the front line of the fight against the spread of this virus. One West London doctor recorded a diary of her experiences over the past week as guidance and practice on dealing with patients has steadily changed. Watch.
4 days ago, we decided that we needed to reduce the risk of spread of COVID-19 to patients and staff to protect our most vulnerable patients. So we changed all our face-to-face consultations to telephone consultations, and we're still bringing in some patients if we feel that it's necessary after triage. And so this has proven to be quite difficult for our reception staff and our admin staff. I've spoken to lots of patients today who have respiratory symptoms. They've mostly spoken to 111, and if they haven't been eligible for testing for COVID-19, they have then called us to ask us to book them in for testing, but we are just not able to do that, and explaining that to patients has been difficult. So a bit challenging today. I had to speak to a couple of patients who really wanted to come in, but I had to explain that we're trying to protect them and the population and our staff here at the practice. So trying to explain that we were doing things on the telephone. So it's interesting how different people are reacting. Some people are really accepting and understanding of the telephone consultation situation, and others not so much. Unbelievably, we've noticed that this stuff, hand sanitizer, has been going missing from our stockroom. So we're now having to lock it away after work. Also, just wanted to say how strange it is to see an empty waiting room here at the practice. Absolutely unheard of. And yeah, definitely makes us all feel like there's definitely something going on, and changes the whole atmosphere really.